Hey, welcome back. Or if you're new here, hi, I'm so glad you found this video. If you're watching this, there's a good chance you're standing over your shower drain going, or came to 13 bind. What is happening to me? Maybe you're pulling clumps of hair out of your brush. Maybe you're watching your ponytail get thinner by the week. Maybe someone finally said the words postpartum hair loss to you, and now you're here because no one warned you this was coming. I see you. I've been there. And I want you to know, you are not going bald, you are not sick, and you are absolutely not alone. In this video, I'm going to walk you through everything, what postpartum hair loss actually is, why it happens on a biological level, when it starts and stops, what genuinely helps, and what is a total waste of your money. I've done the research, so you don't have to. This is going to be a longer one, because this topic deserves a longer one. So grab your coffee, get comfortable, and let's talk about your hair. Section 1. What is postpartum hair loss? Let's start with the basics, because a lot of what's out there is confusing or incomplete. Postpartum hair loss has a clinical name. It's called telogen effluvium. That term sounds scary, but it's actually just a description of what's happening in your hair's natural cycle. Let me explain. Your hair doesn't all grow at the same time. It goes through phases. There's the anagen phase, that's the active growth phase. Most of your hair, about 85 to 90%, is in this phase at any given time. Then there's the catagen phase, which is a short transition. And then there's the telogen phase. That's the resting phase, where the hair is basically just hanging out before it falls out naturally and gets replaced. Normally, only about 10 to 15% of your hair is in telogen at once, so shedding is gradual and you barely notice it. Now, here's what pregnancy does. During pregnancy, your estrogen levels skyrocket, and high estrogen actually pauses the hair cycle. It keeps more of your hair in that active growth phase and stops the normal shedding from happening. So you end up with more hairs on your head than usual. This is why so many people say their hair looks amazing during pregnancy. Thicker, shinier, fuller. That's not a myth. You're literally holding on to hair you would have otherwise shed. Fast forward to after delivery. Your estrogen levels drop, and they drop fast. Your body is no longer in pregnancy mode. And all of that hair that was being held in the growth phase, it all gets the signal at once. Okay, time to shed. So instead of the normal gradual hair loss you'd have every day, it all comes out in a rush, sometimes over weeks, sometimes months. That's what you're experiencing. And here's the key thing I want you to hold on to. You're not losing more hair than normal. You're losing the hair you should have lost over the past 9 months, all at once. The technical term for this, when a large proportion of hairs enter the telogen phase at the same time due to a trigger, is a telogen effluvium episode. It's the same thing that can happen after major surgery, extreme stress, significant illness, or crash dieting. Your body goes through something big, and the hair responds. This is normal. This is documented. This has been happening to postpartum women forever. You are not an anomaly. Section 2. Why does it happen? The science. Okay, let's go a little deeper on the science, because I think when you understand why something is happening, it becomes so much less scary. Hormones. The primary driver is estrogen. During pregnancy, estrogen levels can be up to 100 times higher than normal. That's not an exaggeration. These elevated hormones do a lot of things. They support the pregnancy, they affect your skin, your mood, your metabolism, and they affect your hair follicles. After birth, estrogen drops back to pre-pregnancy levels, often within the first few days postpartum. Progesterone also drops. This hormonal shift is the main trigger for telogen effluvium. If you're breastfeeding, there's another hormone in play, prolactin. Prolactin is responsible for milk production, and it suppresses estrogen. So, if you're breastfeeding, your estrogen may stay lower for longer, which can sometimes extend the hair loss period, though research on this is a bit mixed. Nutritional depletion. Here's something that doesn't get talked about enough. Growing a human is nutritionally expensive. Even if you were eating well during pregnancy, your body prioritizes the baby. If there were any nutritional deficits, your body will have directed nutrients to fetal development rather than, say, your hair. Postpartum, especially if you're breastfeeding and not eating enough, deficiencies can worsen or prolong hair loss. The key nutrients involved in hair growth are iron, one of the most common deficiencies postpartum, especially after significant blood loss during delivery. Ferritin, the stored form of iron. This is often low even when hemoglobin looks normal. Zinc. Biotin, though frank biotin deficiency is actually rare. Vitamin D. Protein. Your hair is made of keratin, which is protein. I'll come back to this in the what helps section, but I want to plant that seed now. The role of stress and sleep deprivation. Let's be honest. You just had a baby. You're probably not sleeping. You may be anxious, overwhelmed, healing physically. The emotional and physical load of new parenthood is real. Chronic stress elevates cortisol, which can also disrupt the hair cycle. Sleep deprivation affects cellular repair and hormone regulation. These factors don't cause postpartum hair loss on their own, but they can layer on top of the hormonal shift and make recovery slower. Thyroid function. This is important enough to give its own mention. Postpartum thyroid dysfunction affects somewhere between 5 to 10% of women in the first year after delivery. It often goes undiagnosed because symptoms, fatigue, hair loss, mood changes, weight changes, can easily be attributed to just being a new mom. If your hair loss seems severe, is lasting longer than expected, or comes with other symptoms like extreme fatigue, brain fog, feeling cold all the time, or unexplained weight changes, please get your thyroid checked. We'll talk more about when to see a doctor at the end. Section 3. When does it start and when does it stop? This is probably the question I get asked the most, and I want to be honest with you. The timeline varies, but there are general patterns. When it starts? For most people, postpartum hair loss starts somewhere between 2 and 4 months after delivery. Sometimes it starts as early as 6 weeks. Occasionally, it starts closer to 5 to 6 months. It often starts subtly. You notice a little extra hair in the shower. Then it ramps up. And then there's usually a peak period where it feels like a lot is coming out at once. That peak is often around months 3 to 5 postpartum. When it stops? Here's the good news. Telogen effluvium is self-limiting. That means it stops on its own. For most people, the heavy shedding phase lasts 3 to 6 months. Most women see the shedding taper off significantly by 6 months postpartum, and hair is often back to its previous thickness by the first birthday of the baby. I know, that feels like forever when you're in the middle of it. But I want to be clear. For the vast majority of people, this resolves completely without any intervention. What it looks like as it's ending. As the shedding slows down, you'll start to notice baby hairs. Short, wispy little regrowth hairs, especially around the hairline and temples. These can be a little frustrating to style. Hello, frizzy halo, but they are a really good sign. That's your hair growing back. When it might go longer, hair loss that persists past 12 months, or that is very severe, warrants a conversation with your doctor. It may indicate ongoing nutritional deficiencies, especially iron/ferritin, thyroid dysfunction, postpartum depression or anxiety, chronic stress affects hair. Another underlying condition like alopecia areata or androgenetic alopecia that was unmasked by the hormonal changes. I'll talk about red flags and when to seek help in the outro. A note on hair texture changes. While we're on the topic of hair changes, many women notice that their hair texture changes after pregnancy, even after the shedding stops. It might become wavier, curlier, drier, or coarser than before. This is real, and it's caused by the same hormonal shifts. For some people, it's temporary. For others, it's permanent. Your hair may come back slightly different, and that's okay too. Section 4. What actually helps? All right, this is the section you've been waiting for. Let's talk about what you can actually do. I want to be upfront. Nothing will stop postpartum hair loss. It's a natural process, and it will run its course. But there are things that can support your hair health, potentially shorten the shedding phase, help your hair regrow more robustly, and help you feel better in the meantime. Get your labs done. Before you spend $1 on any supplement or product, get blood work done. Ask your OB or midwife for ferritin, not just hemoglobin. Ferritin can be low even when you're not technically anemic. Thyroid panel, TSH, T3, T4. Vitamin D, zinc. Use B12 if relevant. Low ferritin is extremely common postpartum and is one of the most actionable things you can address. Studies show that ferritin levels below 30 nanograms per milliliter are associated with increased hair shedding. Some hair specialists recommend optimizing ferritin to 50 to 70 plus for hair health. If you find a deficiency, correcting it can make a real difference. Druhý, eat enough protein. Your hair is made of keratin, a protein. Postpartum, especially if you're breastfeeding, your protein needs are higher than normal. Many new moms are so busy caring for their baby that they're barely eating or surviving on snacks. Try to prioritize protein at every meal: eggs, meat, fish, legumes, Greek yogurt, cottage cheese. Aim for at least 70 to 100 grams of protein a day if you're breastfeeding, more if your provider recommends it. Třetí, consider a postpartum specific supplement. A good postnatal multivitamin can help cover nutritional gaps. Look for one that contains iron, if you're deficient, B12, vitamin D, zinc, and folate. What about biotin? Biotin has become almost synonymous with hair supplement, but I want to give you the nuanced truth. Biotin helps with hair loss caused by biotin deficiency, which is actually quite rare. If you're not deficient, extra biotin probably isn't doing much for your hair. It won't hurt you, but it's not a magic bullet. More useful supplements with better evidence. Iron, if labs show deficiency. Vitamin D, most people are deficient. Omega-3 fatty acids, some evidence for scalp health and reducing hair loss duration. Collagen, early evidence is promising, contains amino acids that support hair structure. Always check with your provider before starting new supplements, especially if breastfeeding. Čtvrtý, be gentle with your hair. When you're in the active shedding phase, mechanical stress makes things worse. This means avoid tight hairstyles, ponytails, buns, braids that pull on the follicle. Be gentle when brushing. Use a wide-tooth comb, especially on wet hair. Temperatures, minimize heat styling. Don't overwash, once every 2 to 3 days if possible, though this is hard for many people. Use a sulfate-free, gentle shampoo. None of these will stop the shedding, but they reduce the mechanical hair loss that layers on top of the hormonal shedding. Pátý, scalp health matters. A healthy scalp is the foundation of healthy hair. Some things that support scalp health. Gentle scalp massages. Using your fingertips for 5 minutes daily can increase blood flow to follicles. There's even a small but interesting study showing that regular scalp massage increased hair thickness. It's low risk, free, and relaxing. Scalp serums with ingredients like niacinamide, caffeine, or peptides can support follicle health. Avoid harsh chemical treatments during the shedding phase if you can. Šestý, styling strategies for volume. While you're waiting for regrowth, these can help. Volumizing shampoo and conditioner. Apply conditioner mid-shaft to ends only, not the scalp. Root lift products, mousses, and sprays can create the illusion of more volume. Dry shampoo adds texture and volume. Tinting root touch-up products can make the scalp less visible through thinning areas. Haircuts. A shorter cut or layers can make thin hair look much fuller. A good haircut is underrated here. Part your hair differently. A side part often conceals thinning better than a center part. Section 5. Myths and things that don't work. Okay, I have to talk about this because the internet is full of postpartum hair loss solutions that range from useless to actively harmful, and I don't want you wasting your money or your energy on them. Myth 1. You're losing hair because you're breastfeeding. Breastfeeding does not cause postpartum hair loss. The hormonal shift happens regardless of whether you're nursing or not. Non-breastfeeding moms experience it too. If anything, breastfeeding may slightly extend the period because prolactin suppresses estrogen, but stopping breastfeeding to save your hair is not necessary and not recommended. Myth 2. Hair loss gummies will fix it. The beautiful pink gummies with the celebrity endorsement on Instagram? I hate to break it to you, but they're largely biotin and collagen in a candy form with a $40 price tag. Unless you're biotin deficient, unlikely, the biotin isn't doing much. Some do contain useful vitamins, but you can get them cheaper in a regular postnatal. Myth 3. Washing less will stop the shedding. I know this is tempting because you see so much hair come out when you wash. But washing less doesn't stop the hair from entering the telogen phase. It just delays when you see those hairs fall out. You can wash your hair normally without making the shedding worse. Myth 4, castor oil will grow it back faster. Castor oil is thick, very difficult to wash out, and there is no strong clinical evidence that it speeds hair regrowth. It may help with scalp moisture, and that's fine, but it's not a treatment for telogen effluvium. Myth 5. This is just genetic. Nothing you can do. Genetics do play a role in how severe your experience is, but postpartum hair loss is almost universal. It's not just bad luck genetics. And because nutrition and scalp health genuinely matter, there are things within your control. Myth 6. Minoxidil will fix it. Minoxidil, Rogaine, is a proven treatment for androgenetic alopecia, genetic hair loss, but it's not intended for telogen effluvium. Using it during postpartum hair loss is unlikely to be necessary, since the condition resolves on its own, and it's generally not recommended while breastfeeding. If your hair loss turns out to be androgenetic alopecia triggered by postpartum changes, that's a different conversation to have with a dermatologist. Before I let you go, I want to talk about when to get professional help, because I never want anyone to dismiss something that actually needs attention. See your doctor if your hair loss has been going on for more than 12 months without improvement. You're losing hair in patches, not diffuse thinning, actual bald spots. This could be alopecia areata. You have a receding hairline or thinning specifically at the temples in a pattern that's getting progressively worse. This could be androgenetic alopecia. You have other symptoms: extreme fatigue, brain fog, feeling cold, weight changes, heart palpitations. Please get your thyroid checked. Your ferritin hasn't been tested, and your hair loss seems severe or prolonged. Ask for it specifically. It's often not included in standard panels. You're experiencing symptoms of postpartum depression or anxiety. This affects your overall health, including hair, and you deserve support. A dermatologist who specializes in hair loss, a trichologist, can be incredibly helpful if you're not getting answers from your general practitioner. They can do a scalp analysis and pull test and give you a much clearer picture. A word about mental health. I can't end this video without saying this. Hair loss can be genuinely devastating. Your hair is part of your identity. Losing it while you're also sleep-deprived, your body is changing, and you're navigating the hardest learning curve of your life. It's a lot. It is okay to grieve it. It is okay to feel sad, frustrated, or angry about it. Those feelings are valid. They don't make you vain or shallow. They make you human. But I also want to offer you real hope. The research is clear, and the lived experience of millions of women confirms it. For most people, this ends. Your hair comes back. It takes time, and time is hard to accept when you're in the thick of it. But you will look in the mirror one day and realize the halo of baby frizz is just hair. Growing hair. Your hair. You grew a human. Your body did something extraordinary. Give it grace as it finds its way back to equilibrium. If you found this video helpful, please share it with a new mom who needs it, because I guarantee she has not heard enough about this, and she probably needs someone to tell her she's going to be okay. Leave me a comment below. Where are you in your postpartum journey? When did your hair loss start, and how are you coping? I read every single comment, and I love hearing from you. Subscribe if you want more content like this. I talk a lot about postpartum recovery, maternal health, and life with a new baby. And I'll see you in the next one. Take care of yourselves.